If you have watched this channel for any time, and I know some of you have, you will have noticed that many times I have mentioned various programs to help seniors who are struggling with their prescription drug costs. The biggest of which is the Low-Income Subsidy Program, or LIS program, sometimes called Extra Help. But what does it actually do? Who qualifies for it? And how do you actually get it? Let's talk about that today. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during the AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So undoubtedly, one Medicare cost that has been underfunded for over the last decade or so has got to be prescription drug coverage. There are millions of seniors every year who struggle to keep up with the cost of prescription medications, and the standard methodologies of helping them pay for medications are still leaving them with astronomical RX costs. All the while, prescription drug costs are rising astronomically. This is why the LIS program exists and is accessible even if someone has reasonably high income. The LIS program is a program run by the federal government, and what it does is lower somebody's copays, deductibles, and even monthly premium for the prescription drug coverage only. It does not apply to Medicare Part A costs or Medicare Part B costs. But what it does do is collaborate with one's Medicare Part D plan and pays for many of the leftover costs that normally would have to be paid by the Medicare beneficiary. So LIS itself is not a prescription drug plan, but what it does do is help pay for those costs that Medicare beneficiaries have when they have prescription medications and have Medicare Part D plans or Medicare Advantage plans that include Medicare Part D plans to help pay for their medication. So let's look at an example of how this works in dollars and cents in 2025. Important to note is that the LIS program does update every single year. And that means that as the cost for medications go up, so does the coverage for LIS, but also means that the assistance will change from year to year as well as the eligibility. So these numbers we talk about are just for this year, 2025, and in 2026, we'll probably make a new one. So if we look at the most updated CMS memo about LIS, it shows that for folks who have the lowest income, if they are enrolled in the LIS program, they will have a cost of $0 for their Part D deductibles, $0 for their generic medications, and $0 for their brand name medications. Generally, these beneficiaries will be on both Medicaid, or Medi-Cal as it is called here in California, and Medicare. Additionally, for those folks who have both full Medicaid and Medicare coverage and their income is a little bit higher, they will still have a $0 cost for their deductibles, but they will also get a $1.60 copay per prescription for generic medications and $4.80 for brand name medications. Keep in mind, if there are $0 copays for those medications on the standard Part D plans, like at level 1 and level 2 on some of those plans, they will still keep those $0 copays. It's not like they have to pay more because they get the LIS program. Now, for all other folks who qualify with the even higher incomes up to 150% of the federal poverty level, we'll talk about how much that actually is. They will still get a $0 cost for their deductibles on their Part D plans, but for their medications and their copays, they will have a set copay at $4.90 copay per medication for generics and $12.15 for brand name medications. Now, a final note on this portion is that except for the lowest income individuals, there is still going to be some copays for prescription, even if someone does qualify for the program. And also, as of 2025, because of the Inflation Reduction Act, there is a limit, a cap of $2,000 per year for the total prescription drug spend for the year that all Medicare beneficiaries can have, whether they qualify for LIS or not. Now, of course, there is more nuance to the LIS program, and if you have questions, contact a professional. I might have a suggestion for you. But that is the gist of it. Now, let's talk about which plans someone can choose, because one cannot just choose whichever Part D plan they want and still have the LIS program pay for the full monthly premium. But the copays and the deductible benefits will still be reduced regardless of the plan. So the ones we just talked about, those will be applicable regardless of the plans, but the premiums are something that may not get paid in 100% depending on the plan that someone chooses. In fact, there are specific plans called benchmark plans that have monthly premiums that fall within the $29.66 monthly in 2025 premium limit for the LIS program. Here in California, the two plans that are available that fall within that criteria for Part D are the Cigna Assurance RX, as well as the WellCare Classic. Again, someone can choose others, but if they have the LIS program, it will help them pay for their premiums, but it may not pay for the full monthly premium for that benefit. So with all that said, obviously, LIS is a good program, but let's talk about who is eligible and at what level. There are actually a variety of ways to be eligible, but the simplest way to look at it is going to be based off of income. Again, there is some nuance to this. It's not just income. So if you own additional properties or have life insurance with cash values, those can affect one's eligibility, but not always. But in this case, we're going to look at one's income, which is based off the FPL or the federal poverty level. Now, the FPL is an average from around the country of incomes, and it is a chart that most programs in the US will use to figure out if somebody is eligible for need-based benefits or not, and if so, how much. If we look at the chart, we can see that the first level for FPL for the LIS program is for those folks who have incomes below 100%. So that'd be for an individual income below $15,060 per year worth of income. For two people, that amount goes up to $20,440. This number will go up for each additional member of the household. The next range is going to be for those folks between 100% FPL and 150% FPL who will qualify for a slightly higher copays that we just previously talked about. The higher FPL limit would mean that those households' incomes can be up to $22,590 per year for one person, or $30,660 on top of that for two, which is still going to allow for folks to be eligible for the program and is noticeably higher than the limit to be eligible for Medicaid or Medi-Cal here in California at 138% FPL. So I know someone may say, well, I'm not eligible for Medicaid or Medi-Cal. I probably may not be eligible for LIS. And that's wrong. You might actually still be eligible for LIS because you can have a higher income. That being said, there is a paper form that usually gets sent out to anyone who might be eligible, and that form gets sent out in the mail. But you know, a lot of times it gets thrown away. But it can also be downloaded online, and I'll put a link down below for that in the comments. But also, probably the best way to do it is just to do it online. That can be done through the Social Security website, and it's not through the Medicare website, but it is through the Social Security website under the Extra Help link. Again, I'll put that down below. So there you have it, the quick and the dirty about LIS. And there is so much more to it, really, but just if you or somebody you know is struggling with medication costs and have Medicare, you may want to encourage them to consider applying, or you may want to consider applying. There's literally no reason not to. The worst that they can say is no. Additionally, it's not Medicaid, so it doesn't have the same stringent estate payback requirements that a lot of folks worry about with Medicaid or Medi-Cal, and that can be a big hairy deal. But again, if you or somebody you know has questions about LIS or their Medicare health plans, please feel free to reach out to us at the information down below, and either me or one of my team will be happy to help them in person or over the phone at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.